welcome back to 3 Under 3. This week I'm going to be doing part 2 of Emilia'S update, talking all about what's gone on with her since we originally found out. If you missed my last video, it was basically an overview of her diagnosis and kind of first thoughts and just everything that our family kind of went through with that. It was pretty long because there were a lot of emotions and a lot of feelings and just a lot of stuff to explain about what exactly retinoblastoma is. If you missed it though, I will definitely link it down below, and then I'll put a little thing up top for you so that you can check it out if you're interested and learn a little bit more about her condition. Today though, I'm going to move on from that and start talking about what it was like going through treatment, and we'll see how far we get. I don't want this video to be too long for you, so if I can get through everything today, including an update on her, that would be great, and if not, then I'll do a part 3 like I mentioned before. All right, so with that, let's get started. Okay, so after we first found out Emilia'S diagnosis, they wanted to start treatment pronto. Because retinoblastoma tumors are notoriously aggressive, and there is the risk that it could have spread out of the eye to other parts of the body, specifically the brain, an area in the brain called the pineal gland. They wanted to get things moving really quickly, which we were totally okay with. We wanted to just get on top of it and get her treated as quickly as we could. So to keep things a little shorter for us, I'll kind of just describe to you what a round of chemotherapy looked like for Emilia, and then let you guys know that she did do a total of 4 rounds of chemo, and that was all that she needed. We were told that she could do anywhere from 4 to 8. It just depended on how her tumors responded. Basically, they respond the best in the beginning, and then as they get used to the chemotherapy, we would see the response decline. And when it came to a point where the negatives of chemo were outweighing the positives that we were seeing with the treatment outcome, then that was when we would decide that we were no longer going to continue. And for her, that happened really early. So she had really good response in rounds 1 and 2. 3 was okay. And then by round 4, she really wasn't responding. The tumors weren't shrinking anymore. So they said there's no point in putting her through anymore. The risks associated with it, they're higher than the benefits that she's getting from it. So we're going to stop, and we're going to look at some more focal therapies as opposed to systemic. So one of the main reasons that we chose to go with systemic chemotherapy for Emilia, because there are more side effects associated with systemic than there are with intra-arterial chemotherapy, which is one of the other popular ways of treating retinoblastoma. So what that is they insert a catheter through the baby or child's leg, and they feed it all the way up through the circulatory system into a tiny, tiny artery in the very back of each eye, and they actually inject a highly concentrated dose of chemotherapy right into the back of the retina, and that alleviates the need for chemotherapy to go through the whole body systemically, and it just treats the tumors in the eye. That can be very effective, and there are some places in the States that solely use that treatment. However, our team felt that because Emilia'S case was so advanced, it was DE in her right eye and D in the left, that there was the chance that some retinoblastoma cancer cells could potentially have left her eye at some point, and they could kind of just be floating through the rest of her body. And there was always the risk that that could cause mets or additional cancers in other places. So basically the way they explained it to us is that doing systemic chemo would hopefully pick up those rogue cells if they happen to leave the eye, and it would prevent her from, developing tumors elsewhere that we might not know about until much later, and that could be very bad for her outcome. So we decided to go ahead with the systemic chemotherapy. So what did that look like for 4 rounds? Systemic chemo was not nice. It is everything that they say it is and then some. So all of the things that you see in the movies, on TV, that you hear, the rumors are true. Yes, you lose your hair. Yes, you throw up. Yes, you have diarrhea. Yes, you lose weight because you have no appetite. You feel like crap. Your blood counts go down. There's always the risk of a transfusion of either platelets or red blood cells. and you are always immunocompromised. So with that, those are just kind of the things that you always have to look out for. When you're in systemic chemo, it's not nice. It's really not. And watching her go through it was really, really hard. Your body starts out pretty strong round 1. By the time we were done at round 4, I was thrilled because I could see it was really starting to get the better of her. Basically what chemotherapy is it's a poison that's injected into your body with the intent of killing any cells that are fast reproducing. So it doesn't differentiate between a cancer cell and an intestinal lining cell, a skin cell, a blood cell, bone marrow, any of those cells that rapidly reproduce. So like the cells of your hair, like I said, your skin, the insides of your mouth, often you'll get sores, any cells that have to reproduce quickly in our body because we're damaging them all the time. Those are the cells that are most affected by chemotherapy, and that's where the side effects come from. So Emilia did experience almost all of them at some point, some worse than others. She did not go totally bald, which wouldn't have mattered anyways to us because she was born bald and she was beautiful then. But she did lose quite a bit of hair pretty evenly though, so she didn't have any big bald spots. She's still growing it back, but like I said, that wasn't a big deal. Vomiting definitely occurred, especially after this first round, second, third, and fourth. On the way to and from the hospital, she would get really sick anytime we put her in the car, and there were a few episodes at home that were just awful. Nausea was brutal. She hardly ate anything. She somehow didn't really lose too much weight because she was still a big milk drinker. So I think we just kept her calories up with that. But yeah, it wasn't very nice. I can just to say that straight up, it wasn't very nice. She did not end up needing any transfusions. Thankfully, we were so happy, because there was a very close call at the end of round 3 where her platelets got so low that they were worried that she would start spontaneously bleeding internally. But I asked if we could just wait a day or two, because when the technician that collected it did her collection, I noticed that she was kind of, being a lab tech, I noticed just the way she was collecting it could have potentially affected the result that we were getting for platelets. So I asked, can we come back in 2 days? If I notice any petechiae or spotting on the skin that looks like little bruises, I'll bring her back right away. But I haven't seen any bruises, so I just feel like that result is not 100% accurate. And they were really good about saying, yeah, that's fine, we won't transfuse her yet. But we came back 2 days later and she had come up enough that it was no longer a risk, which was so nice, because there's always the risk with a transfusion that you could have a reaction, something could go wrong, and that was just not something that I wanted to put her through unless it was absolutely medically necessary. So now that we've talked about all the things that she went through, like I said, let's talk about a typical round of chemo and what that looked like. We would go on a Wednesday to Sick Kids and arrive around 8:30 in the morning. She would have her audiology exam done, which is basically they would try to put headphones in and she would always say no. So they would end up having to set up a speaker on either side of her and they would play a noise on either side. And when she looked, that counted as like a positive reaction to the sound. The reason that they had to do this was because the carboplatin drug that she was given for chemotherapy, which is the most effective drug to treat retinoblastoma, is also extremely toxic to developing ear. So it can cause them to go deaf very quickly in some cases. So they have to do a hearing test before each and every round of chemo, because if they notice that the chemo is affecting the hearing, then we would have to weigh the pros and cons of stopping chemo in order to preserve her hearing. And even though she ended up not having any effects to her hearing whatsoever, there is always the risk that she could lose her hearing earlier in life. So she will have yearly audiology exams from now until forever. So after we went for her audiology appointment, assuming that everything went well there, and it always did, which was great, then we would head on over to pre-op. We would register and she would get ready to go in for her exam under anesthesia. So this was an opportunity for the team to look at where she was at at that point. Her first exam obviously was just a starting point, and then the next one after that was to see how well round 1 of chemotherapy worked. And they had to do this every time before administering the next round because we had to have like a baseline for where the tumors were after each stage. So that involved knocking her out, taking her into the OR, examining both eyes, taking pictures, and then they would come and talk to us after, explain if things were going well, if things had changed, if the tumors were shrinking, if so, how much, if they saw anything new. They didn't laser or do any cryotherapy during this point because they were just focusing on letting the chemo do its job and seeing how well it worked. So she would wake up from that. Usually we had to be in pre-op for about 2 hours. We would get there around 10 o'clock. She would be there until 12:30 for her surgery, like start time, and then she would usually wake up around 2:30. By the time we were all finished, we would leave around 3:30 or 4 o'clock from the hospital. So it was a pretty long day by the time we got home. And then that was the Wednesday. So the Thursday of a chemo week, we headed back to the hospital. We had to be there for 9 a.m. to check into the outpatient oncology department. So we'd check in. The nurses would come and do all of her vitals, check her weight, do all of her like heart rate, blood pressure, you name it. They do all the little tests that they do. They would set up her port so they would access it, which is basically just a needle that gets inserted into the chest. They tape it all off and kind of run a line. And then they would put some saline, start running some saline through it while we were waiting for her chemotherapy drugs to be prepared. So on day 1, she would get carboplatin and then vincristine and also a saline drip with those. The total amount of time I think was around 4 hours for those to both run through. And then I think it was an hour of saline after. So she was hooked up for at least 5 hours. And sometimes like, they won't make up your chemotherapy drugs until you've checked in and they've checked your weight and made sure that everything's good. So from the time we got there, sometimes it would be an hour or 2 of just waiting in the room for the chemotherapy drugs to actually arrive and get hooked up to her. So that was a really long day. And it's hard because when she was only like 16 months old at the time, trying to get a 16-month-old not to pull or pick at or touch a line that's attached to them, and it has like, it's not one cord, it's like 4 different cords so that they can hook up a saline and then flush this and do that, and they come in so many times and check it. It was a pain. Like I had to always have someone helping me because if I had to go to the washroom or something, that would be when she would find her line and start pulling on it. So there always had to be somebody there, and she also had to be like in her her stroller the whole time. Because she couldn't go running around. She would step on the line, she would trip. It wasn't ideal, but treating a baby that young never is. So you just make the best of it. We brought the iPad. We would play a lot of games with her. We tried to time her naps so that hopefully she would nap for like 2 hours of that 5-hour drip. And sometimes we would just take the pole with us and go for a walk in the stroller around the hospital if it was nice. Sometimes it was too hot, but yeah, so that's what a Thursday would look like. And then we would head home, and before we headed home, they would always give her a dose of ondansetron in her IV because I couldn't get it down orally. She would just immediately throw up as soon as they tried to give it to her. And what ondansetron is it's an anti-nausea medication. So it basically would help her not to feel the urge to profusely vomit all the time, except that giving it to her made her vomit. So it didn't really work very well for her. They could get it in her via the IV though. So that was great. So that would get us home, usually from the hospital without any vomiting episodes, which was great. So unless we hit really bad traffic, and then by the end of the drive, she was pretty close to like letting it rip in the car. But like I said, for the most part, we could get home without any major throwing up issues. Then we would have to go back Friday morning to have her etoposide chemotherapy. So she got a combination of 3 drugs: carboplatin, vincristine, and etoposide. They can't all be given on the same day. They've carbo and vincristine together, and etoposide was a 4-hour drip followed by a 2-hour saline drip, and that had to be done by itself. Obviously, it's 6 hours of sitting there. So that was always done on a Friday. The Friday was probably the hardest day of the 3 because going into the hospital Friday morning, it didn't matter how little food I gave her or how much food I gave her, there was always projectile vomiting pretty much the whole way. Like my mom would just sit in the back seat with her in the car and hold a little like bucket and wipes, and we would put like, I bought her the like the plastic long sleeve bibs that you can buy at IKEA, and she would just like puke everywhere, all over herself the whole way, because like I said, I could not get the anti-nausea meds into her at home. She would just throw up. She did not like the taste of it. Didn't matter what I put it in pop, I put it in juice, I put it in anything, nothing. So that was always a terrible car ride. We'd get there, again, we would usually have to wait at least an hour, maybe 2 for her medicine to arrive. And then it was like 6 hours of walking around the hospital, trying to keep her entertained. And this is day 2 of this. So now she's like, I've had enough. I want to get up and run around. You know, I'm like 16 months old. I want to explore. And we couldn't let her do that. And by this point too, like she would kind of feel crappy from the day before and all the drugs that she had been given. Another thing I will mention that I didn't know is that, I mean, I knew, but I didn't realize chemo is like really, really toxic. Like when the nurses come in and they're dressed in like head to toe hazmat suits with 2 layers of gloves and a mask, and they tell you, when you change your diapers at home, make sure that you're always wearing gloves. Always wearing gloves. You know, like what they're putting in her body is, it's really gross. So yeah, she felt like really not nice all the time. So at the end of that day, we would, again, they would administer her anti-nauseas via her port before we left, because I explained to them, like, I can't get to dinner, so if you can do it so that she doesn't throw up the whole way home, that would be great. The first 2 rounds of chemo, I don't think she got sick, but by the 3rd round, she was just so sick all the time that even those anti-nauseas, like, they just weren't doing it. So she would get sick in the car quite frequently on the way home on the Friday as well. And then even if I had to run out and do a short errand, anytime that I packed her up to take her in the car, I had to bring several outfits, and I had a little actual pack in my car of outfits and wipes and plastic bibs, like everything you would need for a massive projectile vomiting session, because it happened so often. It was really not nice. And I tried to limit going out as much as possible, because for her, I just felt so bad. Every time we would go in the car, she would just get so sick. So that is what a typical round of chemo looked like, actually receiving the chemo. And then, so Wednesday through Friday. And then on the following Tuesday and Thursday of the next week, we would have to go to McMaster, which was our satellite site closer to home, and get her blood work done. So we would go there, check in, she would play for a bit, they would come, they would do her blood work, and then we would have to stay around and wait. So they were basically just checking her counts. They wanted to check her red blood cells, white blood cells, and platelets. So for those of you that don't know, anybody going through chemo, their bone marrow is severely affected by the chemotherapy. It can totally deplete it, and it's not good because you need those cells in order to live. So platelets are like the things in your blood that make it clot. So if you don't have enough of those, then you can bleed out. And that is the one thing that Emilia did have issues with at one point. It got really low. So we were a little bit concerned about that, and we might have to have a transfusion, but we avoided it, like I said. The white blood cells are the infection fighting cells. So they want to monitor those to make sure that she has enough of them, that she's not severely immunocompromised. If her levels got to be too low, they would actually postpone her next chemo from 3 weeks to 4 or 5 or 6 weeks, however long it took for her counts to come up high enough that they could safely administer it. Because when they administered the next round, they would drop even more. And if they got too low, then even something like a small cold could potentially be very, very bad for her. So her levels never got that low. They got really low at one point, but not so low that we ever had to postpone chemo, thankfully. Like, she did recover. And that was also due to the fact that she was on a medication called GCSF, which was injected by me every single day in the back of her arm. And there are some side effects that go along with that. So because the whole point of that drug is to stimulate the bone marrow to make more white blood cells faster, it's basically like hiring overtime employees at your factory to get things going much, much quicker. It can long-term lead to higher risk of certain cancers like leukemia. But at the time, they advised us that it was the best option because if we didn't use it, her bone marrow would likely just get so depleted so quickly that we would have to put off chemo, and that was not a good thing because that would give the tumors more time to grow back. And it was also a risk that she could get really sick because her counts would get so low that she wouldn't be able to fight anything off. And being a little kid, kids catch things. So yeah, we just decided that that was the best option and we gave it to her. And hopefully we never have to regret that decision. But as of right now, I don't. It kept her counts pretty good. And yeah, we didn't have any major issues with her white blood cells. And the other thing they look at is her red blood cells. So those are the oxygen carrying cells, and they make the hemoglobin, which anybody who's ever been iron deficient, you know what it's like to be iron deficient or a low red blood cell count, which is like to be anemic. It means you're extremely tired. So Emilia never needed a transfusion. She did come close a couple of times, never as close as the platelets, but pretty close. And that wasn't very nice. You could just tell, like, before we would go for the blood work that she was low because she would be just tired all the time. And instead of napping for 2 hours in the afternoon, it was like a 4-hour nap and she would wake up still exhausted. So it definitely did a number on her red blood cells, the chemo, but luckily we never needed a transfusion. So that was good. Yeah, so after her 4th round of chemo, they decided that it was no longer working effectively enough to continue, and they told us that the next best option for her would be to do some cryotherapy and some laser therapy. What this means is they still knock her out and put her under anesthesia. They look at the eyes, they assess everything, and then, they would use a laser or like freezing therapy to target the tumors specifically and kind of either burn or freeze them away. So we have been doing that ever since the end of last July. So we're coming up on a year pretty soon. It was every 2 to 3 weeks at first. And then as things got more and more under control, we are now doing it every 6 to 8 weeks. So that's really nice for Emilia. It means she has to go less and less pokes, less prods. I don't think there's not supposed to be any pain associated with it, but she does seem irritable and just kind of out of sorts, and her eyes look a little swollen and red after. So I don't think they totally know how it feels for them. It just depends on how much they have to do. But yeah, so we're doing that less frequently now, but it has been continuous throughout the whole thing. And then Emilia, like I said I would talk about last time, in September of last year, we spoke to the doctors about a new procedure called a vitrectomy. And what that basically is, it's a removal of the vitreous humor of the eye, which is like the jelly that's inside of your eye. So for Emilia, the tumors that she developed, how do I explain this best to you? They were stuck to the retina, and then they would also stick in places to this jelly that was inside her eye. It's kind of like a spider web type thing inside, if you can picture that. And when the tumor started to shrink and die in the right eye, rather than pulling that vitreous towards the retina, they pulled the retina out toward the front of the eye. And what that did is it created, instead of the retina lying nice and flat, it created pulls in the retina where it pulled it up like this in folds. And any areas that were like this weren't getting the blood supply. So the retina has to lay flat in order to receive an adequate blood supply and for the cells to work and for you to be able to see with those areas of your retina. So it's really, really important that it be nice and flat. When it got pulled up like this by the tumors moving forward, those areas were useless for vision. Even if they were able to receive light, they were not functioning. So the doctors advised that we should think about doing this vitrectomy procedure. And originally they told us that we would have to go to China because it had only been done a couple times in the world, in the US and Canada, on children with retinoblastoma. The reason being that anytime that you enter the eye with a surgical instrument on a child with retinoblastoma, there is the risk that you could pick up cancer cells, and on the way out, they could be deposited to other areas, and that cancer could leave the contained space of the eye and metastasize to somewhere else. So they were very, very hesitant to perform this procedure on kids like Emilia for that reason. But there was one surgeon, and he was amazing, and he agreed to come, and we were all set to go to China. We were totally ready. We're like, yep, we're going to China. We're going to have to be there for like 6 months because she can't fly when she has oil in her eye, and they might have to fill the eye with oil. We don't know what's going to happen until we get there. But he ended up saying, you know what? I'm going to come there, and I'm going to do it for you in Toronto. So he came and did that for her in September, end of September last year, 2018. And we weren't sure what the outcome would be because it's a very delicate procedure. The retina is only maybe a layer of cells or 2 layers thick. And so dissecting it all out and removing the vitreous was, like I said, it was very delicate, and he is incredibly, incredibly skilled, this man. But it was very successful for her. They only did it for her in her right eye because the left eye, just the way that the tumors were, it wasn't an option. But the right eye, which originally was her worst eye and the eye that they said we might have to take out, is now, because of that procedure, her good eye. And she actually regained, I think, I mean, I can't tell for sure, but I think quite a bit of central vision from that procedure, which was incredible. And it's totally changed her. She's so much more confident. She's just amazing. She does so much better now because of that. So we are so thankful that he came and did that for us. We can't thank him enough, really. It was amazing that we were offered that opportunity. I think Emilia was only the 3rd or 4th kid ever in Canada to receive it. So yeah, that was a big deal for her. The recovery from it was not fantastic. She required 3 sets of drops 4 times a day, every day for a month and a half. So I had to do those at home, and a lot of times I had to learn to do them by myself, which was really hard. Trying to hold down your toddler and administer drops that sting several times a day while holding their eye open and dropping. It wasn't the easiest thing, but we got into a bit of a routine, and by the end, she was a pro. She was really good at it, and she just kind of knew this is part of life. Mommy's going to do doctor drops on me now, and it is what it is. It's to fix our eyes. So she's a superstar. What can I say? She's awesome. So that is, yeah, that's basically the extent of the treatment that she received up until September. Ever since September, like I said, she's been getting monthly EUAs and laser treatments to maintain what's there. We get the question a lot still 1 year post, you know, well, she's not on chemo anymore, so she must be like better, right? She doesn't have cancer anymore. And the truth is that no, she does still have cancer. At her last EUA, they let us know that the right eye looks very good. They did a little bit of lasering of some scar tissue that they were slightly concerned with, but the left eye they didn't actually do anything on, which is a good thing and also not a good thing. They said that the left eye has one area which is a tumor that is mostly calcified and dead. However, there is one area that's fleshy and it just seems to be dormant, but they're not able to laser it because of the location and the fact that it's surrounded by calcifications. It can't be lasered. We just have to watchfully wait and hope that it doesn't reactivate and start growing again. So if it does start growing again, the only option at this point would be to put her back on chemotherapy again, which we obviously really don't want to do. We were really hoping for her port to be out and for her to start kind of living a more normal kid's life, not being on 24-hour fever watch, not having to worry all the time, being able to, you know, go to daycare and go to play places and do things that are a little bit too high risk for a kid that's on fever watch all the time. But for the time being, we're still waiting. We are hoping that within the next 2 to 3 months, we'll be able to kind of make a better assessment as to whether or not that spot is going to reactivate or if it's going to stay dormant and not. But we have been told that up until the time that she's 5 years old, there is always the risk of new tumors developing, and we do have to, like I said before, watch out for the possibility of a brain tumor. So it's kind of one of those things where we're excited and we're really, really hopeful because she's doing really, really well, but we're not holding our breath because there's always this kind of dark cloud of the possibility of something reoccurring is always kind of there. So yeah, that's where we're at. So yeah, I guess we kind of condensed this video from possibly 3 into 2. Like I said, there's not a whole lot going on with her right now. It's pretty much we've reached kind of a flat line, which is really, really exciting and awesome, but also a little bit nerve-wracking, and I don't really know what to think about it. I don't know if I should feel a sense of relief or kind of keep my guard up, but we'll see. I don't know. I think as time goes on, without there being any negative things any negative news, then I'll get more and more relaxed about it. At this point, we're just preparing for the upcoming birth of our twins. I'm now 29 weeks, so they will be here soon, and they will actually both need to be tested immediately via cord blood samples to see if they also have what Emilia does, because there's no way of guaranteeing that it is not genetic from either myself or my husband. But we're really hoping that it was just a one-off and that they'll be fine. I will keep you guys posted and updated on everything to do with them as well, though. And I will continue to do periodic updates on Emilia as things occur. Hopefully it's all positive, and yeah, we're really, really optimistic, and we have been so blessed because I know there are so many other mamas out there who have retinoblastoma babies and who do not have such a great outcome as Emilia has, and my heart goes out to each and every one of you. But just know that they are making advances each and every day, and things are getting better for our little ones, and I'm really, really hopeful that the future is bright for our kids and full of light. So thanks again for watching, guys. If you have any questions, as always, please just leave them down below in the comments section. If you like this video and you want to see more, don't forget to hit the subscribe button before you leave. I probably should have said that at the beginning because this video is getting to be really, really long. But yeah, like I said, if you like it, give it a thumbs up and hit subscribe. I would love to have you as part of our 3UNDR3 family. Take care. Bye.
If you need a hand, I am here for you. If you get lost, I'll lead you back, yeah. Walk that extra mile.